Non-surgical penis enlargement is a treatment in plastic urology that allows for an increase in both the thickness and length of the penis while it is flaccid, with only a thickness increase in the erect state. This procedure lasts only 30 minutes, but its benefits could change your life forever. It is carried out through the application of hyaluronic acid along the entire length of the penis. The procedure is painless and provides incredible results that you will notice immediately, allowing you to walk out without any issues after the intervention. Depending on the patient's desires and characteristics, temporary, semi-permanent, or permanent results can be achieved. Procedure. Before commencing this intervention, the doctor must assess the patient's needs and desires to jointly design the ideal member the patient wishes to obtain. A mask is placed on the patient's face to help them remain calm, as they will be awake during the intervention. To start this procedure, evidence is collected by measuring the length and width of the penis, so that the patient can verify the before and after results of the intervention. Next, the doctor uses advanced technology to apply local anesthesia, which is painless, with the patient feeling only slight movements in their member as the doctor works on it. The procedure is carried out with the penis at rest to ensure the safety and effectiveness of the treatment. The doctor will perform surgical cleaning to sterilize the genital area. Then, the specialized doctor will carefully inject hyaluronic acid into the subcutaneous tissue of the phallus around the corpora cavernosa without touching the functional structures of the male member. Most punctures are made on the lateral sides of the penis, as in these areas, healing occurs rapidly within 24 hours. The doctor will continue filling with hyaluronic acid until achieving a more aesthetic shape that is appropriate and close to the patient's desires, always respecting the anatomy of their member. Upon completion, the patient is placed in front of a mirror to appreciate the results, and although these results are visually noticeable, the doctor remeasures the width and length of the penis to confirm that the growth and thickening have been appropriate. Recovery. To initiate the recovery process, the patient should wear a suspensory scrotal support for a period of 2 weeks. The significant advantages of this innovative procedure are that men can leave the clinic and almost fully resume their normal lives. They can go home, to work, to a party, or even to exercise. They can even drive a car and travel by plane. However, there are some restrictions. The patient should not engage in sexual intercourse or enter pools or hot tubs for a full 2 weeks. Furthermore, during the first 4 to 5 days, it is important to drink more than 2 liters of water per day, because 1 molecule of hyaluronic acid attracts 1,000 molecules of water. So the size of the member will have a significantly increased volume. From day 6 to day 30, the member will gradually deflate. At the end of the first week, any bruises will have disappeared. And at the conclusion of the second week, one can resume sexual activity. This should be done with care because the member may still be slightly swollen in some areas, giving the appearance of deformity as if the filler has shifted. This happens because some areas are still inflamed and a bump may be visible, causing slight deformation, but this is temporary and only due to inflammation. After 1 month, the swelling of the male member will have completely subsided, and the patient will be able to appreciate the final enlargement of their member in a resting or active state. This is a good time to send a photo to the doctor to assess the final result. Warning: hyaluronic acid is a biocompatible and absorbable substance, which means that the body breaks it down and eliminates it over time. Since the results of enlargement with hyaluronic acid are temporary, lasting from 1 to 4 years, patients often undergo additional enlargement sessions periodically to preserve the result or even achieve a larger size according to the patient's desires.